Hi guys, welcome back to my channel. This is Skin First Daily. If you are new here, welcome. And this is a space where we literally just talk about lifestyle, healthcare, things, weight loss. Weight loss is, I think, one of the biggest things we talk about here, okay? Like, we are always trying to find that body, without having to do crazy surgery or any crazy changes. So I like to say this is like a lazy girl's guide to weight loss, okay? Quick and easy, instant gratification. Most of the time, that's what we talk about. And of course, we talk about lifestyle as well, just things that make you feel good, products that make you feel good, reviewing them. So, if you haven't subscribed to my channel, please subscribe and let's get into today's video. Okay, so today's video is very important to me, very dear to me, because it's a struggle that I went through, and which is my fibroid story. So I am going to tell you, well, I shouldn't even call it struggle, right? Because there was a big ass light at the end of the tunnel, and I cannot wait to share with you everything about it. So this series is basically going to be a 3-part series where the first part is going to be the diagnostics, like everything that came before or during the surgery. So the pre-surgery, during surgery. Then we're going to do the second part series, which is going to be the after, right? Like everything that happened after 1 to 7 weeks or 9 weeks, 1 to 9 weeks of the surgery. So like everything in between, you are going to get raw data, like real details. So okay, stay tuned. And the third part is tips, all the things you need to get. Make sure you save that so that you can always go back to it, like everything to buy, everything you need pre and during and after. Like, I am going into details of what helped me to go through this process seamlessly. Honestly, I'm not gonna lie to you, watching YouTube videos, I saw a lot of people saying how it was hard and they had the worst time and it was the worst experience, or the fear, the craziness. I am grateful that I had a great support system. I had my family, my best friends, shout out to them. But I'll give you all the details. But honestly, this journey was not as hard as I thought it would be. I think the hardest part for me was the research. Like, for the fact that I never knew what fibroids were, and then I get it, and I'm like, yo, what the fuck? What is fibroids? Like, how is it growing? And I'm one of those people that I'm very, very solution oriented. Anybody that knows me knows if you come to me with a problem, we're finding a solution. Okay, so the fear, I guess, for me was just like, what is this? How is it growing? What did I do wrong? How can I fix it? The anxiety that came with it. But honestly, seamless process. And I think the reason why it was so seamless was, 1, my support. 2, I was ready. I was ready to do it. So let's get into the story. This is the part 1, and then I will link part 2 and 3 in the description box, so then you can follow me and watch everything as I upload them. So let's get into this video. Okay, part 1, let's go. Before we get into this video, let's talk about the silent statistics around fibroids. Honestly, do you know that 85 to 90% of women will get fibroids in their lifetime? That is a huge number. And it's crazy how people don't talk about it. Like, I knew a few people that had fibroids, but did not know they had it until after I told them that I had it. That's wild. Even like parents, like, it was crazy to me to see like parents, grandparents, like everybody has gotten fibroids at least once in their life, but nobody talks about it. So I was really shocked when I found out that so many people get it and people just don't like to talk about it. I think that was one of the reasons why I said, you know what, I'm going to record this video. My mom is like, don't do it. But listen, mama, I love you, but I think it's very important to let everybody be aware so everybody's comfortable when this thing does come up. Okay, now time for my story. So let's start from the beginning. All right, if you are following me or you've watched my other videos, I have been struggling with hormonal imbalance, right? I got on Wegovy because I was like, what's going on with my body? I don't understand. I keep gaining weight. I'm not losing weight. And the worst part is, like, I would exercise. I would go to the gym 6 days a week, and my belly would just not reduce in size. I'm a little slim thick, but like I wanted like a flat stomach. I'm like, yo, I'm going to the gym trying to get a 6-pack. What's going on? Why is it not happening? But instead, it's like my but I kept getting bigger, like very weird. I just kept getting bigger, and my hormones were just all over the place. So I got on Wegovy because I was like, okay, let's see if this will help me. So if you haven't seen my Wegovy story, you can literally get it right here, or just go watch my videos. I have a series for Wegovy. And so I started taking it, and I lost about 15 pounds in total. And I was slimmer, right? And I felt good about it. But then my stomach was just big. And the funny part about it was that it wasn't just big, it was big and hard, like round and hard, like here, right? Look at this. Crazy. And then it was kind of weird because I would always get hungry. I would be hungry all the time. If you know about fibroids, you know fibroid feeds on carbs and sugar when you eat it. So every time I'm hungry, and I became super lazy or fatigued. I don't know which one it was, but I felt lazy. Like I would wake up and just not have stamina for anything. Even the gym was like a hustle, but I was like, I need to, I want to, but I was feeling super lazy. And then my back, hey, my God, my back was killing me. Like if I was to bend down to pick something from the floor and stand up, yo, it was as if there was a big, heavy thing on my back. Like it just hurt so much, to the point that I actually thought all these things that were going on with me, the backache, the laziness, I thought it was adulting. I'm like, oh my God, I'm getting old. I'm in my mid-30s. Jesus, help me. Why am I old? Is this what old age feels like? Damn, right? The discomfort was very real. Just to add some of the discomforts, I had constipation. My God, I was constipated all the time. So I actually thought the constipation was the reason why my stomach was so big, right? Because I just wasn't pooping. And then TMI, but like when I would poop, the poop would come out really skinny. And I didn't understand why. I'm like, what is going on in my body? You know, when you just know something is wrong, like I just knew, I could just tell something is wrong with my body. And I was just all over the place, all over the place. Then the worst part is that when I want to poop, the lower part of my belly would hurt so much. Like if I needed to poop and then I'm constipated, it's not coming out. So like, you know, I'm backed up. My lower belly will be hurting. It's almost as if something, like I thought like maybe maybe I have maybe some disease. I don't know. I was just nervous because the pain was a lot. So the constipation was really hard on me. But every time I would then release and poop, then it would go away. But then if I ate again, boom. And then I was always craving carbs. So I would eat like yam and stew, eggs, bread. Yo, my belly was crying for help, crying. Then the other thing was my stomach was so big that I literally looked like I was 4 to 5 months pregnant. Huge, right here, huge, right? I'm exercising, I'm doing all the right things. Why is my belly so big? I was doing apple cider vinegar, I was doing lemon water, I would go on water fast. Like, why is my belly so big? I was literally crying. Then the worst was menstrual cramps. My goodness, I don't even know. It's weird because at first I didn't really have menstrual cramps, but what I had was more like I had the average menstrual cramp. No, actually with menstrual cramps, I think I had like your average menstrual cramp, right? Initially. And then all of a sudden it just started getting bad. Like once I get my period, it's almost like I can't walk. And then I am bleeding. Like it's still the same 5 to 7 days, right? Of the whole period, the whole cycle. But the cramps lasted like 3 4 days, and it was painful, and then flowing heavy to the point that I went from using like a super tampon to no I went from using a regular green size tampon to using super. Then super became too small because I was changing it like every like 2 hours, which normally you could change it every 4 hours. And now I had to move to ultra. Do you know what ultra is? Ultra is like the beast, right, of tampons. So I had to move to ultra, and that's when I knew, okay, something is really wrong. And then the cramps, I couldn't walk. Like my back, my stomach, it's like all angles. It's like being beat up, honestly. It was just painful. I would take my regular Advil painkillers. Usually when I take my painkillers before my period, I would feel better. But this time around, I was not feeling better. It was hurting. It was painful. It was so it was horrible. Horrible is the word for the kind of period I was getting, okay? I mean, I survived it. Like, I would literally get up, get hot water, get a hot pad, take the medications. I was probably taking way more Advil than I should have been taking. But at the end of the day, I was like, okay, this is crazy. And then the fatigue, the laziness, the tiredness, the carb craving, it was just a lot. So I stopped wearing tampons and then I started wearing pads, but I would see a lot of like blood clots. And I'm like, yo, something is going on in my system. I need to go to the doctor. I need to go to the doctor. So what I did was, which I don't advise this, but this is what I did. So my insurance was kicking in and was going to restart in January. Usually I'm a very healthy girl, so I do not really pick, like, how people pick the biggest or the best health insurance. I'll be picking the list that takes out the least money from my paycheck because I don't really get sick. Like maybe a headache here, maybe one thing there, but I rarely ever get sick at all throughout the year. But this time I was waiting and I was like, if I end up doing the research now, the surgery now, it's going to cost me a lot of money. So let me wait till my insurance is about to be renewed. And then I will pick a really good package that would help me through like surgery and anything else that comes during this year. So I waited till January, till the new cycle started. And I ended up changing my insurance to one that basically had I think it was almost like 80% covered in your surgery versus the one I picked before, which was 20%. So if you're smart, you do exactly that too, because these surgeries are expensive. Like when I looked at my bill of like what it was for my insurance versus what I paid, crazy difference, like humongous. Like we're talking of 100 and something thousand all the way down to like $1,000 to $3,000. Like huge difference. Okay. So yes, my advice for you is to make sure you check your health insurance, pick a really good package when you know this is the year you're going to tackle your fibroids. So when I got my medical insurance, I didn't know where to start. I didn't even know if there was like a doctor for fibroids or who you go to, technically to your OBGYN, but I didn't know that. So what I did was because I didn't even know what was wrong with me. I didn't even know it was fibroids, right? I'm here thinking, something's going on with my body. I feel sick and I feel crazy. So let me go to my doctor. So I went to my PCP and I just told her I knew it was going to be something drastic because everything going on in my body was just ridiculous. So I said, let me start off with my PCP first and then we'll go from there. So I go to my PCP, we do all the testing, all the STD testing, we do all the health testing, insulin, glucose, A1C. We do the full spectrum of every test you can think of. She goes in, looks in there, and then she's like, ooh, I think you have fibroids. She was like, but I need you to go to your OBGYN and find out and let them do the full scan ultrasound and let them figure it out. Okay, so go to your OBGYN. So I go to the OBGYN, he does an oral sound and then says, oh, you have fibroids. But for us to see how big it is, we have to do an MRI. So I ended up going to an MRI X-ray office, and then they end up doing the MRI. When he got the results, he looked at it and was like, oh, you have 2 huge fibroids, 3 medium-sized fibroids, and a couple of small ones. So I basically had like 2 huge grapefruits and a bunch of oranges, big oranges. So, when he said it, I was just like, oh my God, fibroids, am I gonna die? Like, what is it? I have no clue what fibroids are. And then, he's telling me the different treatments. He's telling me about the laparoscopic versus the myomectomy. Of course, I'm scared. I'm like, myomectomy, that's like C-section. I was like, I don't want to get cut. So I'm like, can I do the laparoscopic? And he was like, he doesn't think I would be a good fit because it's too big, but he referred me to a laparoscopic doctor who he claims was like the best laparoscopic doctor in the best laparoscopic doctor, blah, blah, blah. So I go to meet the laparoscopic doctor. She's looking at my MRI, and then she tells me, I ask her, I was like, I'm really scared. I don't want to do the C-section. It's too much downtime. Is it possible to do the laparoscopic? But let me know if it's too big and I have to do the myomectomy. If not, then that's fine. So she's looking at it, and then she tells me, oh yeah, we could do a laparoscopic, we could do the laparoscopic to remove it. So basically what I had was I had fibroids behind my uterus The big one was behind my uterus. I had a few on the left side of my uterus, and then I had one inside of my uterus. So she was like, oh yeah, we'll do laparoscopic, we'll take them up, and then we'll do, I think it's called heteroscopic, where they take it into your vagina and then pull it out. So she was like, oh, we're gonna have to do those two procedures, blah, blah, blah. I was like, okay, cool. I go, but it's huge. How are you going to take it out with laparoscopic? So laparoscopic is basically non-invasion, where it's not non-invasion, it's less invasion, right? Because they put like cameras into your they put the cameras and the thing in through your stomach, but they don't create like a big hole, and then they kind of use the machine to kind of cut, like cut it into pieces and then bring it out, right? Oh, the cool thing about the MRI is they send me pictures, and I am very, very, very into research. I can't even lie to you. So I was like, okay, I'm looking at the pictures. I'm like, wow, that's huge. Like, oh my God, how am I going to do this? So the thought I had was like, how is she going to do the laparoscopic thing? Because in reality, you have to chop it up into little pieces. That means I'm going to be bleeding a lot because she's going to be in there for a while. If I have five and one is that big, how is she going to do it? I don't know. I just didn't feel comfortable with her procedure. So I was like, you know what? Let me go get an alternative perspective from another doctor. So I'm researching, online. And let me tell you something. If you are like me, you are one of those people that like the best of the best. Like when you travel, you're looking for the best hotels. When you're looking for where to live, you want to be in the best area. Listen, healthcare, I am not playing with healthcare. I want the best of the best. How much? Let me know how much I got to save. I will save up for the surgery rather than going to a doctor that is not that great. That is me anyway. And I think everybody should do that too, because you got to take your health as number one. So I start researching. I find this doctor. He has like a 4.9 4.9 stars with like 10,000 plus comments, reviews. And he is known for fibroids. He's known for childbirth. He's known, like, that is his thing. So I was like, all right, let me start talking to him. Let me go visit. Let me see. Let's talk. Let's get a good vibe of him, and let me hear what he has to say. So I go to his hospital, and honestly, the first meeting I had with him, I was like, yeah, this is my doctor. He literally broke it down to me. I showed him all the tests, the MRIs, the ultrasound, all my, the A1C, all the different tests, blood work that I did. I showed him everything, printed it out, showed it to him. And he said to me, look, it doesn't make sense for you to do a laparoscopic, because if you do a laparoscopic, the fibroids are too big. It's going to take forever for us to cut it up and then take it out. And you're going to lose a lot of blood. And you don't want a case where you're losing blood, you need blood tonic, and then, the surgery becomes even worse than it's supposed to be. Instead, he goes, do a myomectomy. I know you're scared of the downtime, but trust me, it's not as bad. We're going to cut you up. He goes, I'm not going to make it big. I'm going to make it a little smaller. And I'm going to go in and just take out all the fibroids. Yes, you're going to need to do the heteroscopic because you need to go take the one inside out. But it's better for me to open it up, see what I'm working with, and remove everything that you have in there. If I'm doing the laparoscopic and you're losing a lot of blood, I would have to stop. But if you're doing the myomectomy, fast. I was like, all right. I was like, okay, I like the way he's talking. He seems sensible. He literally answered my concerns without me even talking about my concerns. So I was on the right path mentally about what I was thinking. So I said, you know what? I'm going to go with this doctor. I like him. I like the way he talks. I like the fact that he's super knowledgeable. So, I had questions. So I'm asking him like 1,000,001 questions. And I'm telling you, he and his nurses made me feel so comfortable. I could see why they have 4.9 stars, honestly. Super comfortable. So he asked me, when do I want to do the surgery? But I think I started procrastinating because I was a little nervous. So I'm like, November, maybe October, November, because I don't want to lose my summer. I want to have fun. I want to go out. I want to do things. I was just using that to procrastinate, but in reality, the pain was a lot. You're saying you want to literally drag out your suffering till November. It cannot be that serious. Literally just do the surgery. So I was like, all right, I'm going to do it in a month. Okay. So that's how fast this was. They told me what I had. In a month, I said, let's do this. And we did it. All right, so pre-surgery preparation, right? What did I do? I literally did my research, like made sure I was covered mentally, physically, and spiritually. Of course, you're praying, you're fasting, you're trying to make sure, like telling God, like, please God, I don't want anything bad to happen. 2 weeks before my surgery, I had to do a complete lifestyle change. So my doctor is like, no smoking. So if you smoke hookah or whatever, like you cannot smoke at all. No alcohol, gotta give up the alcohol. No drinking. And then no sex, no nothing. Like my doctor was like, you cannot do anything for those 2 weeks. Okay. Also, I stopped eating red meat. I stopped eating dairy, reduced carbs, started eating a lot more protein. And because these are the things that they say enlarging fibroids. So I cut them out for those 2 weeks. I started drinking a lot of beet juices. I did a lot of juicing actually. Beet juice, the ABC juice. I have it as well here if you want to, if you want to know more about the ABC juice right here, you can also do it. And yeah, so I cut out a lot of things, just got into this healthy mind frame, praying, fasting, did all the right thing pre-surgery, but all the things that I needed, which I will talk about in part 3, all the things I needed pre-surgery, post-surgery to make sure that I am comfortable, okay? Like we did the whole 9 yards. The morning of the surgery, okay. When I tell you my anxiety was at 100, I don't know why. I just started having all these thoughts about, God forbid, what if things go wrong? What if I lose my uterus? What if I lose my uterus, my ovaries? I don't know. Like, when you're about to do such a big surgery, your mind is just racing. And I don't know about you guys, but like with surgeries, I've never really had like major surgeries. I've had a couple of surgeries, but not like as intense. Like this one is like a little scary, like they're cutting you open, they're going inside of you, they're tuggling in there, to remove the things that are not good. They're sewing you back up. Like you got to make sure you have a good doctor and you trust that doctor to be able to do that. Like I was anxious. When I tell you, my anxiety was just ridiculous. One thing I would tell you is that make sure that when they give you paperwork at the hospital, you are very conscious of what that paperwork is. Like I remember there was one that said, of course, if something goes wrong, they can take out your uterus. I was like, no, put the fibroid back in. Do not take out my uterus, okay? There are other options. I'm sure there are other ways around this. That is not an option. Please no. I was like, nope. Then the other thing was like, oh, the doctor, are you giving the doctor permission to do a blood transfusion if something goes wrong? And I said, no, I'm going to need them to speak to my parent, my mother, my sister, before, and they have to approve it, not the doctor. And the reason I said that is because sometimes I feel like when you're not related to someone, they just do things quick and easy, right? And we don't want that. I want people who love me to make that decision. And I know my mom. My mom is like one of the smartest people I know when it comes to things like this. So I was like, go talk to my mom and talk to my sister before you do anything, or they're the only ones that can approve any procedure besides what we're doing right now. So my advice for people is that make sure you read the paperwork before you do surgery. Don't just take everything they say take, and ask questions like for clarity. If you don't understand what something on there means, ask questions. It took me at least 30 to an hour to fill out that paperwork. And yes, I am like that. I like to be sure. I like to be very conscious of everything, especially when it comes to doctors. I don't know. I personally feel like when a doctor tells you something, you got to go do your own research too. You just cannot believe everything a doctor tells you, okay? Because sometimes they just do what's best for them or what's best for the hospital or how to get money. So I don't know where that anxiety came from because I've never experienced it, but I've heard about it. So I like to make sure that I know what I'm getting and it corresponds with what my doctor is saying. Does that make sense? Perfect. So when I finish the paperwork, they put me dressed up, they give me like compressors, they put me in the robe, and then my doctor comes, just to kind of talk to you right before you go into the room. I think everything's gonna go well, your blood work is good, everything's good, you're healthy besides this, and we will get you exactly what you need. Okay. I was like, all right, thanks for the assurance. So They come, they give me the anesthesia. Literally, it felt like a movie. As soon as they were taking me into the room, they opened the doors and they're like, I see the nurses go, hi, and then I black out. And then that's it. They do the surgery. The surgery takes about an hour, 30 minutes, which is faster than what we had discussed. He thought it was going to take 2 hours and 30 minutes, but he ended up taking an hour, 30 minutes. And when I tell you they took out all the fibroids, he even like, I think I had a cyst in there as well. He drained the cyst. So that's one thing I liked about my doctor was that, he went in, before we actually started the surgery, he told me, once he looked inside, oh, he saw that. He also saw a cyst and, he's going to drain the cyst and blah, blah, blah. So I like when doctors go above and beyond. It's just nice. It's nice to know when people go above and beyond for you. It makes you feel like family, and that's what this doctor did. He made me feel like family. So he removed the fibroids, drained the cysts, sewed me back up, and boom, an hour 30 minutes, I was done. All I remember is surgery to me is like 100%. You gotta trust your doctor because I'm like, you don't even know what they did inside of you. You don't even know if they took out an organ because literally you're sleeping the whole time. You got to make sure you trust your doctor. And then after the surgery, you better go to another doctor and tell them to check all your other organs because this is crazy. It made me think, sorry to digress, but like people go to like Colombia, DR to go do like liposuction and they cut them up, remove all the fat. How do you know they're not removing or damaging something internally? There's no way to know because you're knocked out the whole time. You wake up, you're sewed back up. There's no way to know what happened inside. You gotta be very, very careful when you're picking your doctor. Very important, okay? So I wake up and the first thing I say, I can never forget, the first thing I say is the surgery over? They said yes. I said, is my uterus in there? Yes. I can have kids? Yes. I was like, all right. And I knock out. Slept off. Knocked out. Oh, I forgot to mention, I took 2 weeks off work because my work is not strenuous. Like it's not like I work in construction or I'm on my feet all day. I sit, I have a desk job. He was like, you can take about 2 weeks off and then you can go back to working. So the 2 weeks is for you to heal completely, no walking. Don't stress yourself at all for those 2 weeks. And then after 2 weeks, then you can start like taking walks and like getting back to it. You can sit up. Just let your outside stitch heal, and it only heals with time and less movement. So don't forget, you have a scar inside your uterus because they've cut it up, they've removed all the stuff in there, and then you have the stitch that you can see, the actual scar you can see on your belly. So you got to be extremely careful, okay, for those 2 weeks. So with research, when I was researching other people who did the surgery, I think they stayed in the hospital for about 2 days before being discharged. I was discharged the same day because I did mine in a clinic versus versus a hospital. So yeah, I ended up being discharged the same day. I was a little nervous about it because I think they waited until I actually peed, until I woke up because I was knocked out. I was so tired. So I slept longer than most patients do. I think I ended up sleeping like 4 hours extra. They're like, this girl does not want to wake up. I was knocked out. So they woke me up and was like, okay, you need to go pee. So I got up. I did feel like pain. They removed the that thing they put in you, the pain in the bag. I don't know what it's called, so I'm not even gonna try to say it. And then they took me to the toilet, to pee. I was so gassy, and then the pee, it was so hard to like push that muscle to pee, and I was trying and I was hurting because of course it's just like literally hours after the surgery. And I was just like, oh my god, it's so difficult. But I finally peed. Once I peed, they were like, all right girl, you can go home. So they gave me foot compressors to use. The foot compressors help you to not get pneumonia, so you have to keep using it because you're not walking. And you need to use it to kind of stimulate your blood circulation. And then they gave me this breathing tube that I use, and I have to breathe into it because you have to keep your oxygen coming in and out so you don't get pneumonia. I guess pneumonia is like a big thing with this surgery, so you gotta do what the doctor says, okay? I was using that thing like every 15 to 30 minutes, okay? So yeah, they had said that because I was on a high dose of painkillers, I'm going to be really constipated. I think I was using I was using 800 grams of acetaminophen and what's that other, this really strong drug? I just can't remember the name. It's kind of just flew out of my head. But because of that, I was going to be very gassy and very constipated, but I need to make sure I poop. Like they said, in the first 2 days you have to poop at home. If you don't poop, let us know. So in the first, so they also gave me those things, those recipe, I don't know what it's called, I'm not even going to try to say it, but basically you shove it in your butt and then you poop. But I ended up not using it. I ended up peeing frequently, which was great because I was really drinking a lot of liquids. And on the second, and then I think on the second day of being home, I finally pooped. Let me tell you, pooping was the most refreshing, orgasmic feeling from my whole surgery. And the crazy part was that when I did that first poop, I have not seen my poop so bulky in a really long time. So now let me tell you what was happening in my body. And then when I'm done with this, then we'll wrap up and go to part 2. But let me tell you what was happening. So my fibroid was leaning, one of the fibroid that was on my back was leaning on my colon. So because of that, think about it. It's leaning on your colon. So your colon is tighter now. So every time I was pooping, it was coming out skinny and long, and I was constipated because it couldn't come out. I would drink those herbal teas that make you poop. Those were helpful, but then but it will come out as water because it's only when it's that liquid that I was able to actually poop. So because it's leaning on my colon, it's coming out thin, I'm constipated, I'm backed up. But now that they've removed the fibroid, yo, that shit was bulky. I was like, I have not pooped like this in a long time. I was shocked. And then when I peed, I didn't even realize it was also messing up my peeing because, when I pee, it was like, I thought that was normal. But after surgery, it was like, I was like, damn, my pee was I couldn't hear. It was loud. It was a lot. That's when I knew I'm healed. And that there was nobody else to thank but God. But yeah, so, all right, I'm going to stop here for part 1. And so this is it for part 1 of my fibroid surgery story. And we're going to keep going with part 2. And for part 2, I'll be sharing my post-surgery experience. Now, that is something to look forward to. Honestly, my post-surgery, that was wild. And a lot of learning. And I'm even going to show you pictures of the fibroid that they took out. Okay? You don't want to miss this. It was wild. When they showed it to me, I was like, my goodness gracious, this came out of me? This was living in me? Wild. And also, I would go into really details of the post, okay, so that you know exactly what to expect. It's very different for everybody because when I was doing the research, people were like, in 2 weeks, they were back to normal. I didn't have that situation. Mine was a little different. So I would address all of that in the second part. And also the reason why you should not do too much because I had an injury. I know. It's part 2 is good. It's gonna be good. So I would release part 2 next week, just to give it a week. And yes. I would release part 2 next week. And if it's already out by the time you watch this, it'll be linked below, okay? So yes, we'll go into part 2 next week. If you haven't subscribed to my channel, subscribe to my channel so that you can get the notification when the part 2 comes out. So if there's one thing I want you to get away from this video is literally do your research and also ask all the questions to make yourself comfortable, to beat anxiety, and also to let you know that this surgery is not as crazy as people make it sound. It is actually going to make you feel 100 times better. So do not prolong it. And honestly, if something is wrong with your body, make sure you check in with your doctor. Don't be like me that usually I would just sit with it like, oh yeah, I'm constipated. Oh yeah. Like I was dragging this for a really long time. And then finally I was like, this is not normal. I waited till the extreme, right? I could have probably done something sooner. So my point for you guys is that please, if there is something wrong with you or you're feeling any type of way, please make sure to check in with your doctor as soon as possible. All right, I'll see you in part 2. Bye.